next stretch in the series is for your psoas muscle. Your psoas is a really big, deep hip flexor. It attaches to something called the lesser trochanter, which is a knob or a tuberosity on the upper inside of your femur. So way up in there you've got a little knob, and attached to that is your psoas and a few other muscles. And then it crosses over the pelvis. It doesn't attach to the pelvis, and attaches to the sides, or what's called the transverse processes of your lumbar, your 5 lumbar vertebrae. So all the way up in there. And if you can think about a muscle that basically starts up in there and shoots down to here, tightening, it's going to do that. Its other function, because it's pulling on something that's on a corner on the upper inside diagonal, is external rotation. So it's also going to pull up and in. If you lie on your back and try to pull your knee towards your chest and it wants to go out, that's because your psoas is very tight. So psoas is super important. We're sitting all day. We're basically putting our psoas into a shortened position. And then we want to get up, but our psoas isn't quite ready to open, right? And so it stays tight, and we wind up having to fire our back muscles to stand up straight while our hips are still slightly folded. So learning how to relax your psoas is super important for low back pain. And also stretch it. But first, we need to relax it. And I'm going to show the first variation like this. So in order to relax the muscle, you need to shorten it, but give it nothing to do. So if I'm lying down here, I'm basically shortening my psoas muscle, but taking it out of gravity. And this, if I lie here for 5 to 8 minutes, the psoas muscle will figure out that it's okay, that it can release, that it doesn't have to hold on for dear life, and it will slowly relax. So I recommend doing this pretty much nightly to all my clients since I've been a massage therapist, and this is by far one of the most popular homework pieces that I've given.